I want to do two things. I want to tell you the perfect story because of how it applies to Saint Croix so well and our need for primary care in our ridings and for every member of the community. But I also want to address an elephant in the room or an 800-pound gorilla, as you might say, at the same time. I've set my alarm for 5 minutes because this is Live for Five, episode 31. This story is going to take longer than 5 minutes, as well as addressing the elephant in the room, the 800-pound gorilla, however you want to say it. And so I'm going to let my phone interrupt me as opposed to me interrupting myself. The gorilla in the room, let's take that on first. The elephant in the room, however you want to say it. Here's the truth. An MLA, someone who is elected to go to Fredericton and be your member of the Legislative Assembly, when that person is new, they have no idea how to do the job. Okay, we just got to put that on the table. You got to look at their previous life experience if you want to cast a vote for them and say, this is the person who I think is going to do this job the best. They're not just going to represent us. They're going to be able to push through roadblocks. They're going to be able to network. They're going to be able to bring people together. They're going to look at ideas. They're going to connect the dots, find roadmaps, et cetera, et cetera. That is what an MLA can do. But of course, they don't know how to do the job by definition. They've never had it before. And so that is just on the table. Now, here's what I want to tell you the perfect story over the next day or tomorrow or a couple of days. The story of the Sackville Community Health Center and what Green MLA Megan Mitton has done to bring healthcare to her riding is the perfect story in the sense of it illustrates a number of things that we need to understand here. First of all, it illustrates how hard a Green MLA can work for your riding, even when, as I've said before, they are not the same color or party as the government. Megan Mitton has done incredible work in Memramcook-Tantramar, her riding, and she gets things done. This is a feature, a quality of all the Green MLAs, David Kuhn, the leader, Kevin Arsenault, and Megan Mitton. But I want to focus on the work that Megan has done in the Tantramar area to get a clinic going. And that's the story I'm going to tell. It also illustrates a second really important piece, and it's this. These things take a long time to get going. A primary care center in our riding, wherever that would be located, to fill in the needs of patients who have been orphaned. That takes a lot of time. I want to talk to you how this story really started in a public sense back in July of 2023, where Megan catalyzed a public meeting with the director of Horizon Primary Care for the Moncton area to get things moving on a clinic or some sort of solution. It was still kind of up in the air at that time, that would take the patients of two doctors who had retired in their area and left kind of what we call medical orphans. My family's in this situation. Our doctors retired in St. Stephen, and now we don't have anyone. So Megan started this meeting in July. She called this meeting and about 30 people showed up in July of 2023, 30 members of the community with the Horizon management to say, hey, here's what we're thinking to get care for the patients of these retired doctors. The solution was to run a clinic just for those people out of a private building, which is right near the hospital, the Sackville Memorial Hospital. Now, I bring this up because, doesn't this sound familiar? In St. Stephen, in the heart of our riding in Saint Croix, we have a hospital, right? We have the Charlotte County Hospital, which of course is doing its best, but kind of like the Sackville Hospital, which isn't open all the time because of, say it with me now, staffing issues. We will get back to that. Um, it's struggling. And of course, we have all these people who do not have a family doctor. So that's the 5 minute bell. Just bringing this to a close. We just got into the introduction of story time. This is another reason why this story is perfect, is in our riding, we have a hospital. We need to find a solution for people who are left without a family doctor because of the retiring doctors in our area. And Megan and the MLA Megan Mitton and the people who at Horizon make these decisions decided, let's get this thing started, open a small clinic out of the Tantramar Community Health Center. Again, this is not health center the way we've been talking about it, full blown. Although this is why I say it's a happy story, it's a perfect story, it's a story filled with challenges and issues even now. But starting way back in July, this little solution began to take root with a vision to expand it out even more and create a full blown clinic. Now, in October, I'm getting ahead of myself, and I shouldn't because we're out of time. In August, the clinic opened, and again, a month after this public meeting, patients were being seen and served when before their doctors had retired and they had no one to see. A second public meeting was called in October. Just again, Megan Mitton called this meeting, and 60 people showed up this time. And the Horizon Health Management were able to report on exactly what was going on. They had a few doctors, nurse practitioners, some doctors remotely coming in and helping patients, nurse practitioners on site. It was not 5 days a week by any means, or 7 days a week, or after hours, or anything like that. But it was this seed that was growing. And by the October meeting, they had seen about 150, 160 patients taking appointments only. But these people were getting primary care. And again, the vision was always that it would become something more. So this is an example of an MLA who can do amazing things, bringing together the people who make these decisions and rustling up the funding. Yeah, that's a very formal term. And that's the kind of MLA I want to be. And I think it's important for you to know that roadmaps exist, but it's also important for you to know how long this takes. And when I'm elected in October, I want this to be happening immediately. I want to be having meetings to make this happen. October 21st is the election. Like, first week, I'm in. I want to start making phone calls and talking to Megan Mitton, my fellow MLA colleague, and saying, how did you do it? How do we get this happening down in Saint Croix? That's why I set my alarm. See, I went way over time even having said it. The story will continue tomorrow, where I want to talk to you about how this clinic in Sackville, picture perfect, no problems at all? Absolutely not. Challenges, of course. But this is the kind of work that needs to be done and can be done and will be done in our riding when I'm elected, because we can do it. Thanks. Join me tomorrow.